have to be there. If you are not around the table, you have the risk to be in the menu. So I do prefer to be around the table on the decision part, not in the menu, with others deciding for us. Now, digital transformation is a key element in the management of any kind of institution in the health sector. Doesn't matter the size of the institution. We as radiologists, we have the chance to be in the leading positions in this digital transformation because of our knowledge, and we have been exposed in the last 10 years to artificial intelligence tools. So we are used to change our minds in terms of the way we are working, but others are moving so fast too, so in other parts of the hospital. So we have this opportunity to be contributing to digital transformation at the institutional level. But for this is not only needed doctors. I remember a conversation I had with my CEO about the Digital Transformation Committee at the board of directors and in our hospital. I said, we need to have more people without great hair because digital transformation is for youngers. So one of the roles that we have is try to involve people from other professions, younger people, bioengineers, engineers, mathematicians, biochemists, physics, doctors. And now we have also the challenge to have in our groups radiologists or doctors interested in understanding what is going on in the technical field, in the IT field, in the development of artificial intelligence, to learn about the language, how to manage, to discuss with engineers. And for the engineers, we need also for them to understand what the problems they are supposed to solve. Because many times I receive companies, even people, asking or offering these solutions for the problems that I don't have, which is quite a crazy thing. Spending huge amount of resources and money for solutions that we don't need at the clinical side. Well, I think it's everywhere. I think integration of the services inside of the hospital, outside of the hospital. In our hospital, we are moving very rapidly to have inpatients in hotels surrounding the hospital, which is much more convenient for the patients and much more convenient for the financial point of view. And a strong relation with the primary care, because we need to have seamless solutions for that. And we need to have tools to better triage and to extract information from the data we have that helps us to make more decisions and better decisions on the patients. And for the patients to have better information too. Now we have plenty of proposals and solutions that offers us to be much more efficient. Plenty of them, based on classical artificial intelligence, based on machine learning, or some of them based on generative AI. But the problem is not to having these tools, because we already have it, and some of them have been proven to be useful in trials or maybe in pilots. But the bridge of having this implemented and demonstrating in the real life that they are efficient, we don't have yet the solution for this. So we have to work especially in implementing, in doing business cases. So that's why it's so important to have bioengineers, managers, people knowing this concept that we doctors, we don't know exactly, because we need to demonstrate these business cases in the real practice in order to monetize. Because my feeling is that many companies in this field are failing because they are not able to find the right business model to be reimbursed. And for us, we were very happy to do that, but we have to really demonstrate they are useful and cost effective, which is not easy at all. I'm afraid no. There's nothing magic. It's good planning for the medical schools to have doctors enough, the doctors and their careers to be well compensated, not just for money, it's just for the future and then good places to work and to fulfill the expectancy of the people coming up to the health system. And we need to apply in the meanwhile, because to have new specialists will last, I don't know, 6-10 years. So for now, it's an opportunity to use really tools that makes us more productive. In radiology, we know that just detecting or measuring or comparing or monitoring diseases, we can use artificial intelligence. In fact, we are using that to be much more productive. But still, we need more than that. More people, probably other professions that can help us with these tools under the supervision and responsibility of obviously by the professionals, but we need to include that. If not, I don't see any solution at all. My feeling is that we need regulations from the patients and the citizens' point of view. The question is how to adapt our way of doing and the tools and the devices that we have to fulfill not the regulations, the expectancy of the citizens and patients in order there be safety enough for them. And I feel there's a long run still to work on this, both from the regulators and for the ones that we are working in validating solutions. Probably we will start to do clinical trials adapted to digital solutions. A lot of people is working on this. I think in the near future we want to have results, but it's not that easy to do that. And I cannot put just the fault on the regulators or on the officers. I think it's a question that we have to be addressed by everyone in the system. Well, in healthcare and in life. So it's not exactly a problem that we face. I think during the COVID, we have increased the funding in many of the countries of Europe, especially in our field. There was with an increase of investments. And I think funding is always a problem, but I think now is a problem is the organization and change management and the way that we are doing things. This is an hypothesis that I condemn at all. So, well, I respect and I appreciate the people involved in leadership, in politics, but I'm not especially interested in that. And for me, it would be difficult to simplify an advice for this. I know where the problems are. I understand that we have to help with this. And it's not always the problem or the guilt is our others. We are always the best, the ones that have always the reason. So we have to understand that. But politicians has a tough work in order to combine interest and future labor, funding. So I need to be cautious on this, but trying to help always from the professional point of view. What is happening is a question of history. We are organizing the hospital mainly by specialties, and people think and their societies are based on specialties. In our hospital for many years, we have the view to organize in parallel the organization in terms of diseases, prevalent diseases. Maybe congresses that I'm sure they are organized on the premises of looking at a group of diseases, and then multi-specialty approach to this probably would be the solution and makes sense on the future organization of all the organizations, instead of having by silos or specialties. I think in many places in Europe this is started to be broken, and group of specialists interested in one specific group of diseases or matters, they are working together and having their own courses. Medicine is based on data, and how to organize data, to have good data, and how to approach and to get information from this data. And we are in the process in organizing data in order to have a good precision medicine. There are a lot of initiatives at European level, European Commission, in order to do that, in cancer and in others. I think it's a question of time that we'll have standardized data. And once we have in there, applying artificial intelligence tools, could be machine learning, could be generative AI, we can manage to have good information at the level of decision with the patient, even for the patients themselves. But still, we need to have more, a better organization of the data and better interoperability. Don't think so. I think we have touched the burning things that we are facing in our daily life. And in my case, that we are be more involved in a new hospital to be built in our institution. It has more than 120 years. I want to build a new hospital. It's a project for 10 years. We are obliged to think about what's going to be a hospital or the, not hospital, or healthcare organization in the next 5-10 years. That could be absolutely different.